All right.
I'm going to call the meeting to order. Thank you for joining us, everyone. This is yet another virtual meeting. We had hoped to be in a live session meeting at the P&I this year, but it didn't quite work out that way. We'll dispense with the roll call, and Lori will take attendance via Zoom attendance. And so the first item of business that we have before us is approval of the consent agenda. The agenda was included in your packet. Approval of the consent agenda includes adoption of the agenda as presented, approval of board meeting minutes, approval of executive committee minutes, receiving the summary of cumulative board actions, and receiving the following committee reports. Is there?
Second.
We have a motion and a second to approve the consent agenda. Is there anyone that wants something removed from the consent agenda to bring up in the regular course of the meeting? Seeing no hands and hearing no comment for removal of any item, all those in favor of the consent agenda signify by saying aye.
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 Opposed, nay. Abstentions. The agenda is approved. It's been 4 months since we had our last regularly scheduled board meeting, and 2.5 since our special meeting in January. And certainly we've had some difficulties along the way with loss. We lost Melvie Scott in January, but it's not just Melvise's passing that we're sad about. We have lost former NACHC staff. We have lost former bureau staff. We have board members who have lost immediate family members, and we've had staff members that have lost immediate family members. So if you just take a moment of silence to think about those who we've lost, both personally, family and friends, but also the 975,000 people who have passed from COVID over the last 2 years. Thank you. Our hearts go out to all of you who have had these losses. We hope that things will improve for you and that tomorrow will be a better day. We had hoped that this would be an in-person meeting. Unfortunately, COVID hung around long enough to force a change from a hybrid type meeting at the P&I to a fully virtual meeting. Certainly staff did a wonderful job pivoting to a fully virtual meeting on a fairly short time frame. And so thanks for your patience as we had to reschedule all of the committee meetings that we thought we would hold in person. And so we had to adjust meeting dates and according to the timelines required for notice on committee meetings. And everybody really stepped up to make the P&I really a big success for us. And I hope you all took advantage of the meeting. I thought it was really a good format and had really, really good content for all of us. Rachel and I did meet with our lead sponsors for the P&I, BKD, Centene, McKesson Medical and Surgical, and NextGen. We met with them in February before as we were shifting to the virtual format. We thank them for their support, and we wanted to have an open dialogue with them and an open conversation with them about the direction of NAC and the role that sponsors play in the support of that work. And a special thanks to Jason Watkins for putting that meeting together. I thought it was really productive for us to sit down with our lead sponsors and just have that conversation. Certainly over the last several months, We've been doing a lot of internal work on improving NAC. And I'd like to really commend Rachel and the organizational development team for the progress that they're making on addressing the priority issues that were identified in the organizational assessment. And I'm sure she'll have an update for you on where we are with the ODT and where we are with all of our DEI efforts. The last couple of months have actually been improving my Zoom meeting skills and team meeting skills. We've been spending a lot of time trying to maintain open lines of communication with all of our partners. And so Rachel and I have really sat down. We met with PCA leadership team. We met with the PCA steering committee. We met with the chairs of the SRPCA reimagining work group to discuss how NAC and the PCAs and SRPCAs can work together in the future and what that relationship might look like. We didn't leave the networks out. We sat down with network folks to talk about what was happening at NAC and how we were progressing through all of the organizational assessment items. And we managed to stop by the Region 4 PCA monthly meeting and also the North Carolina meeting just the other day. We did manage also to have conversations with Senator Tom Daschle and his staff, and also with Congressman Danny Davis, to let them know what was happening within the NAC world and what our direction was and what we were doing to improve the organization so that we can better take care of supporting our health centers nationwide. And then finally, as we look at what's going on with our internal work, you may well note that we've started our process with LINC for organization restructuring. And so we'll have some upcoming meetings that will be dealing with how we can improve the organizational structure to improve the effectiveness of the organization. And then finally, I'd just like to talk a little bit about workforce. Last month, I went out and I visited AT Still, and I spent 2 days with Gary Cloud and his staff as we talked about what AT Still is doing to improve our accessibility to workforce, what they're doing in their training programs. Certainly workforce for all of us is a critical item for us to be able to support health centers, for our health centers to be able to function in today's environment and providing additional care for all of our patient populations. And then, and there's just no way around having to look at how we can best address the workforce needs. Rachel and I did meet with Dr. Luis Padilla last month. We talked about our workforce needs. We talked about the Bureau of Health workforce programs, what alignment we currently had in place. We really need to understand the Bureau of Health workforce programs better. I think it's an area that NAC can improve on. We're really good at understanding the Bureau of Primary Health Care, its programs, its staffing, its goals and functions. We need to improve our communication with the Bureau of Health workforce. We need to understand their training programs and how we can create additional pipelines to our health centers for workforce that's developed through BHW. And then finally, a couple of weeks ago, I did have a conversation with Amanda Pears-Kelly. We talked about workforce initiatives. We'll be meeting with Amanda in ACH next month as we start looking at how we can align future initiatives in workforce development and health center mandatory funding. Not only will we be meeting with ACH, but we'll also be sitting down with the National Rural Health Association and discussing health center related issues from a rural perspective. And so I think as we move forward and as we look at the things that we need to do for funding reauthorization next year, we need to make sure that our interests are aligned across a broad segment of organizations. I'm also in the process of establishing a task force right now for our lookalike health centers. We have the charge for the task force. I'm refining that particular charge, and we're still trying to determine which of the NACHC staff will be staffing that task force. Once it's done, we'll make the appointments. And at this point, in the chair report, I'd like to turn the meeting over to Dan and Geralda for an update on the work that the Task Force for Undoing Racism is doing. Dan, Geralda?
Thank you, Mike. Can you hear me?
Yes.
Great. Unfortunately, Geralda is not able to join us today, and she sends her regrets. But I will report on the task force. And I want to first just start with appreciation both to you and Rachel for your central focus and interest and support in this work. You've both been instrumental in this, and Mike, you picking up from Lathrun in forming this task force. So thank you both. And I want to recognize Rachel, as you've taken on huge responsibilities and passed on the staffing of the task force to Jervine Williams, who has been just a great partner to us, and we're very appreciative. So our report is in the board book, and I won't go through it all. I'll just ground to say that the charge of the task force, as convened by Lathrun, I think a couple of years ago now, Lathrun is to develop actionable strategies that we as NACHC can undertake to lead the health center movement and the country in undoing social and health injustices by becoming a more deeply anti-racist, multicultural organization. To just set some context, Mike, as you said, it's been an extraordinary few years. And I think for us in NACHC over this last year, through our now 6 vision and strategic pillars and our recent organizational assessment, I think we as an organization have clarified our vision for the future of the health center movement. And this has really helped us chart a path towards our organizational goals. I think there's lots of ways for us to speak those goals. I'll put them in just a couple of bullets: that to serve our patients and our communities and help them achieve excellent and equitable health. I think for us as a board, to help solidify and grow the membership of NACHC, and all of that to secure the health center movement and continue to develop us as national and international leaders in outstanding and equitable health outcomes. And so for us as a task force, and I also want to appreciate and recognize there's many members of this task force here today. We are grounding our work in the organizational assessment and the strategic pillars, and recognize through them that accomplishing any of these goals and all of these goals now really requires us to, as a movement, cleave to our roots in anti-racism organizing and in the struggles for justice and dignity. As always, I think for us in the movement, this is really the only way forward. And so we focus on the first strategic pillar, which is to center everything we do in a renewed commitment to equity and social justice. We recognize that component 4 of the organizational assessment has been to implement DEI training programs, and I won't go into those details. So to summarize where we're at now, I think looking at the pillars and the organizational assessment has led us to refine our vision and goal as a task force. And to state that simply, our goal is that the health center movement and we as NACHC and the NACHC board will center our work on the understanding that anti-racist organizing and practice is necessary for our pursuit of the quadruple aim and in excellence in all we do. And so in alignment with all of these, to pick a few things out of this report, we continue to collaborate and work closely with the Bureau to try to aid and support NACHC's close collaboration with the Bureau of Primary Health Care. Angela Powell remains an active participant in the task force. She recently reported to us that drawing on this shared work, the Bureau is now, and I'm quoting her, looking at its processes and systems really through an equity lens, and has come with a recommendation that NACHC collaborate closely with the Bureau to provide guidance, resources, and funding to support tangible equity and anti-racism activities in FQHCs, and that was echoed in one of the recommendations of the task force to this board. We continue to collaborate and work closely with the internal NAC DEI work group and the organizational development team. And I want to just say, I think both of these groups are going to report to this board later in this meeting. They joined our most recent task force meeting, and we were really impressed with the work that's going on internally through these groups. And so, we'll hear from them later. It was our recommendation that they report to the NAC, to the board fully, and we're really glad they're doing so. We also, I want to just, this is not in our report, but we recognize and appreciate our partnering as an organization with Johnson & Johnson in this recent Advancing Representation and Equity in Health Center Workforce funding opportunity. I think this is another piece of how we are tangibly moving forward as a movement. So let me just say, I'm going to get towards the end of this, that individual members of our task force, and I think probably many members of the board, continue to field requests from community health centers around the country asking for guidance in seeking and selecting organizational support for their health centers to deepen their anti-racism capacities. We had made a recommendation to the board and to NAC in the past that NAC organized to provide resources and assistance to health centers in that, to help people consider vendors, to help create sample RFPs and RFP flow sheets. I think we think that this work with J&J is a step forward in that direction, but we ask to really hear back of how we can help move that forward. And lastly, we bring one recommendation to the board today, that recognizing that there's a great intersection in the work of this task force with the LGBTQ+ task force, we make the recommendation that the NAC board authorize and sanction the collaboration between the LGBTQ+ task force and this task force on undoing racism, and that further collaboration should include other NAC DEI work groups, the Clinical Affairs Division, and the Clinical Practice Committee. That concludes our report, Mike. I'm happy to answer questions. I know there's other members of the task force who are here with us who might add or also field questions or conversation about this today. Thank you.
Thank you, Dan. And thank you for all the work that you're doing in this area. It's extremely important for us as an organization, and it's important for all of our health centers. Are there questions for Dan?
Hearing none.
I don't see any hands up. Thank you again. We'll receive your report and take your recommendation under advisement. Thanks. Thanks again, Dan.
Sure.
The next item up for business is the action items from the committee reports. The first action item is from the audit committee, and I believe Willie White is with us. Willie?
Yes, thank you, and good afternoon to everyone. I'm honored to report on the audit committee. The audit committee met on March 17th to review the audited financial statements for the year end June 30, 21 and 22. The audit partners, Amy Boland and audit manager John McIntosh, presented the results of the audit. There were no issues, no audit adjustments or questioned costs, which is a great thing. The audit partners reviewed the highlights and any of the changes over the last 2 years. The opinion from the auditors was an unmodified opinion, which I think everyone knows means it is a clean opinion. The auditors also commented and complimented the NAC staff on their efforts. It's very rare that they have a audit where there are no comments, audit findings, and so they commended the audit staff, and we certainly want to commend Mary and her staff for the great job they do year in and year out. In your board book is a copy of the letter summarizing the procedures that were performed to include the NAC uniform guidance for the audit for year end 21 and 22. Overall, the financial position of NAC is still strong. Total assets actually increased by $10.5 million. A large portion of that was in cash. There was a slight decrease in revenue, and this was associated primarily with conferences and conventions. As you know, many of our conferences moved to virtual events during the year due to COVID, and that had a negative impact on the revenue for our conventions. There was a slight positive change in net assets without restriction of $793,000. And overall liquidity for the organization, we have approximately 9 months of operating expense on hand. The committee recommends that the board approve the audited comparative financial statements for year ending June 30, 21 and 20 as presented. I'm happy to answer any questions.
Are there questions for Willie regarding the audit committee's report? Hearing none and seeing no hands, is there a motion to approve the audit report?
So moved.
We have a motion. Is there a second?
Second.
Second.
Motion and a second. Any discussion? All those in favor signify by saying aye.
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 Opposed, nay. Abstentions? Motion carries. Thank you, Willie.
Thank you.
Next, we'll move to the Finance Committee and John Santasteven.
Mr. Chairman, I think John is on mute.
John,
All right,
could
can
you
hear me
unmute?
now?
We can hear you now. Thank you.
All right, well, thanks, Mike, and good afternoon, everyone. In your board book, you have the financial reports that were presented to the Finance Committee for the 6-month period ending on December 31st of 2021. The financial statements reflect a significant bottom line of about $6.1 million at this point in time. And the big contributor to that is a $4 million unanimous gift that the association received. And so, so that is recognized in revenue. The other positive is, the conference revenues, staff budgeted very conservatively those revenues, and we have exceeded those revenues for the conferences that have already occurred. So they have added to the positive line. The other thing is, our membership is doing well. As of February of this year, we had 648 members in good standing that have paid through March of this year. And that compares to 663 members last year. So we're down 15 members, but overall, our membership is still strong. The other thing to bring to the board's attention is we are in a strong cash position and liquidity. So right now, everything's on track. We are anticipating ending the year with a positive bottom line. So that's my report, Mr. Chair.
Thank you, John. Are there any questions for John in the Finance Committee report? Seeing no hands, is there a motion to approve? We have a motion from Jim to accept and approve the financial report. Is there a second?
Second.
We have a second from Ginger. All those in favor of approving the.
Aye.
Aye.
You're well ahead of me.
Aye.
Any opposed? Say nay. Any abstentions? The financial reports are approved. The final action item from the committee's reports is going to be from the nominating committee and Velma Hendershot. Velma, you have the floor.
Thank you, Mr. Chair. Good afternoon, everyone. So the nominating committee met on March 1st, and we had some staff report related to the update on the 2022 regional elections. We confirmed the positions for election at the 2022 House of Delegates. For the Executive Committee, those positions are Vice Speaker of the House, the Secretary, and the Consumer Board Member. Additionally, there would be one clinical representative to the board and one health center board member to the board. We reviewed and approved the 2022 materials and documents that would go out to the membership. We also had a lively discussion about how to encourage other members to participate in committees and run for regional and national positions. So the request, Mr. Chair, from the nominating committee would be to approve the documents for the 2022 election process at the CHI.
Thank you, Velma. Any questions for Velma?
So moved.
We have a motion from Jim to approve the election documents. Is there a second?
Second.
We have a second from Felix. Any discussion? All those in favor of document approval signify by saying aye.
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 Opposed, nay. Opposed, nay. Abstentions? Motion carries. Thank you, everyone. The next item on our agenda is the interim financial reports or President's report, and Rachel Gonzalez Hanson.
Thank you, Mr. Chair, and good afternoon, everyone. Thank you for the opportunity to be with you today and provide this update. The President's report was included in the board packet, and we're happy to address any questions that you may have. As you've read, the staff continues to focus on the mission of the movement while continuing to perform very impressive work. We appreciate every staff member for their dedication, their work, and for the extra effort they have made to support me during this interim period. Mr. Chair, my appreciation to you, Jackie, the executive committee, and the entire board for the words of encouragement and support that you have shared with our staff and with me during these past weeks. In the interest of time, I really would just like to get to the list of items that we need to update you on that are not in the packet. So we'll begin with just touching base on something that the treasurer, Mr. Treasurer, mentioned earlier, which was that gift. We are now happy to be able to say publicly that we did receive that $4 million gift from Mackenzie Scott. A memo was already shared with the staff, or I'm sorry, with the staff as well, but with the board earlier this week. We understood that Ms. Scott would be giving out that information this week. We wanted to make sure that the board had an update. It is a blessing to have this unsolicited gift fall on our laps, and we'll be discussing internally how best to use this gift, as well as the direct relief grant to help NACC, the organization, improve in its work. I'd like to turn it over at this time, sir, to Mr. Speaker and Joe Dunn to provide an update on the legislative situation. Mr. Speaker and Joe.
Thank you, Madam President, and thank you, members of the board. It's hard to imagine that it's been only a month since the P&I, and I hope each and every one of you had a chance to enjoy hearing from President Biden, HHS Secretary Becerra, and our congressional allies on the great work done by community health centers. Now, there's been a lot going on over the past month. Most recently, as you know, we've had a lot of domestic and international activities going on in Congress. This week, as you know, this is day 4 of the Senate confirmation hearing for Judge Ketanji Brown Jackson. And internationally, we are focused on the war in Ukraine, and we certainly want to send out prayers and be mindful of the struggles that are going on in Ukraine. Also, on another related matter in Congress, Congress just recently passed last week, the Ombudsman spending bill. This bill is long overdue. It's about 6 months behind. It's good to note that community health centers received a $65 million increase, with much of the funding going towards school-based health centers and an expansion of the ending HIV epidemic and new funding for cancer screening programs. It's important to note, however, that the budget sequestration, which will occur, will require a $95 million cut to our program. But I'm delighted to report that this cut will be covered by HRSA, indicated that they can absorb this cut as well. The fiscal year 23 budget cycle will start up on Monday of next week, which with the release of the administration's budget request. Based on the President's State of the Union, we do not anticipate that the budget to include the doubling of the health center program, but it will in fact include an expansion for behavioral health. As part of the recent spending package, Congress did pass an extension to the current telehealth flexibilities for another 151 day. The public health emergency is expected to remain in place through at least mid-July, setting up for the end of the year package for another continuing resolution of the continuation of the health center telehealth policy. Another notable item was that was not included in the spending bill was the additional funding for COVID funding. The Biden administration asked for billions in support of testing, treatment, and vaccines, but the funding was stripped from the final packet after disagreements over how the funding was paid for. The House is expected to take up a $15 billion package soon, but the path in the Senate is uncertain and complicated, to say the least. So we'll be prayerful for new funding coming forward. The administration and Congress leadership still would like to move back to the BBB Act, Build Back Better Act, but the timing of the overall scope of the projects are unclear. As you'll recall, the House passed the bill, including a $2 billion for health centers capital and nearly $6 billion in primary care workforce funding. The bill ran into opposition from a couple of senators regarding cost and competing priorities. You will hear a report later on from Visaria Keys and Jeremy McLean on issues related to 340B. There's a lot going on in the world of 340B. In Congress, the bipartisan 340B bill that I've mentioned before continues to gain co-sponsors, and currently we're up to 78 bipartisan co-sponsors. So that's what's new today in the world of legislation. I'm going to turn the floor over to Joe Dunn to answer any additional questions that might well come from the floor. Mr. Chairman and Madam President, that concludes my report. Joe, any additional comments?
Thank you, Mr. Chairman, Mr. Speaker. I would just say we are very much thinking about the next reauthorization. We're about 18 months away from that. And so thinking about what is it we can be doing today to prepare both the research case and, lining up congressional allies who could take that expansion hopefully forward for us. We are also just trying to stay on top, as I think Mike mentioned, the workforce issue. We'll be releasing a report and findings from a recent workforce study that we did, and was not really all that surprising. Significant staff turnover over the last 6 months. So that's just one other thing that we wanted to just highlight for you all. But it certainly open it up for any questions on any of the particular issues that were mentioned in that report or other things.
Joe, I did have a question on clarification of the telehealth bill. Does that include telephonic billing as well, or just virtual behavioral health billing in terms of the extension for 151 days? I'm already receiving notices from insurance companies saying they're now going to deny payment.
Oh, is that right? For audio only ones?
Yes.
Yeah.
Actually, for non-behavioral health, telehealth, just received an email, a letter last week from Blue Cross indicating they will sunset in June.
I see. Yeah. So the audio only Medicaid provisions are kind of state by state. And so that's interesting that that's happening. I would love to, if anybody else is getting that, just because one of the things we found from a survey from last year was the importance of audio only coverage and care for the health center population, that either because of technology challenges or other reasons that it was so important. So really be interested. Just to zoom out for a second, that 151 days seems very unusual, and it is unusual. The reason why that was an extension like that is because we're not quite sure when the public health emergency is going to end. As Henry mentioned, it will at least go through, the expectation is mid-July. Congress, they did not want to offset or use offsets to extend it when it would already be in place. So that 151 days kind of gives that runway afterwards. And it was a way for the Congress, and it gets a little, too far in the weeds, but just to limit the number of offsets they would need for a short-term extension. The expectation is that there will be some additional research. MedPAC is tasked with doing a report, and one of the factors that they need to look at is around FQHC. So we're now starting to think through reaching out to MedPAC and to inform them about, just to make sure that they are aware of all the uniquenesses of health centers and health center patients. But the extension should include all the Medicare flexibilities that were included as part of the pandemic that have really been helpful for health center patients thus far. So I think Vince was first and then Mary.
Vince had his hand up, and then we'll go to Mary.
Thank you. Thank you very much, Joel, and thank you, Mr. Chairman. I have two questions, one for Joel. And I know this is a sensitive issue. A couple of months ago, we all expressed concern about potential competition for this federal money from another entity. In your work on the Hill, have you seen any evidence that our funding program has entered that confusion where the other organization may be also pursuing that money?
Yeah, so appreciate the question, Vince. If just thinking back to that, when we were at the Florida meeting, they were pushing a pandemic preparedness program. They were not successful in getting that included as part of a bill that we actually got a small provision around FTCA coverage for volunteers. We got that included. So that is less of a concern right now. There is another one we've heard from a couple offices in California that they have been approached around a workforce proposal. I have not gotten the details of that. Based on the public information, it seems like a lot of what they have been suggesting is similar, or if not, very similar, exact to what we would around National Service Corps, teaching health centers, Nurse Corps, things like that, where you broaden the pipeline and hopefully get more of a supply. But I haven't seen exact details, but that's something that, I think one of the reasons why Mike had mentioned meeting with Amanda is to try to work through some of those things moving forward.
Thank you. My second question, Chair, is for the president. And I don't know who we thank for the fabulous donation with Ms. Scott, Mackenzie or Mackenzie Scott, not quite sure. And I was wondering if Rachel would share her Ms. Scott's personal phone number so all of us could jump on that. So we'll... I will defer you to consult with your staff, okay?
Thank you.
Thank you very much, Mr. Chair.
Thank you, Vincent. We'll go to Mary's question now.
Nice try, Vince.
That was good. Thank you, Mr. Chairman. My question is about the funding for the federal portal that just ran out on Tuesday that was supporting folks that are patients that were uninsured. And what our understanding is that we are expected to continue to offer the vaccine to our folks free of charge. And so I'm just wondering, I knew that my assumption, I guess, was that COVID money that the president tried to get would have helped continue some of that, and he didn't get it. Is there any discussion about that? Because I'm concerned about health centers across the country trying to continue that work. And, we're all struggling a little bit as it is and trying to figure out how we're going to go forward. So that would be it.
Yeah, thank you, Mary. That is a really good question, and it's taken up a lot of our time recently. So just to back up for a second, the president requested around $22 billion. That got scaled back. It was included at $15 billion as part of the omnibus bill that was stripped out because the offset for it, you have the two political parties with a different viewpoint on COVID generally, but then specifically on this, Republicans wanted a fuller accounting of the funding that has already been spent. They don't believe that enough of the existing money that's been spent or at least passed that has been maybe unobligated has been used appropriately. So they're thinking that you can take from that existing money and redirect it to the uninsured fund. The other piece of it is that it was stripped out in the House because a number of the Democrats from the states that actually would have provided that offset. So, funding that had gone to a state that just hadn't obligated it or just stated how they were going to spend it, that created a rub. And so the funding was dropped. So now the challenge is, how do you do that when you need bipartisan consensus? The president has been ramping up the noise and the volume on the impact. And so you saw recently, like there was an article the other day about how there's no money for a fourth shot for ages 65 and below, right? So that's very concerning, as some of the groups like Moderna and Pfizer are putting in applications for a fourth shot. So we are going to be sending a letter to the Appropriations Committee outlining some of the things that are specific to health centers around the uninsured program, around the vaccines. Another piece is monoclonal antibodies that is going to run out. I think one of the challenges, to be frank with you, is health centers have had access to the Provider Relief Fund, the uninsured fund, which is part of the Provider Relief Fund, our American Rescue Plan funding, and depending on where you are, a rural fund. So there's a bunch of different pots of money, and I don't have a good sense of how each one has utilized this stream versus that stream. That said, we need more money in the pot because we don't know the twist and turn that this pandemic is going to continue to throw at us. And so having that money to be flexible, I think, is really important. So that's why we wanted to do this letter and get on record.
And Joe, can I add on to that? And then also, I think on trying to think from the operational approach, we have engaged with the HRSA team that is over the uninsured claims fund. We were actually planning a webinar with them about health centers using the fund, and then they didn't get funded to continue to do that work. But we checked in with them just to see how NAC could be supportive. And they did stress that the program is not closed. It just does not have the funds to continue to accept claims. So they're hoping that if there is any progress in Congress, there is the opportunity that they would be able to stand up the program again and be able to take claims. So it really just depends on what's happening. But on the NACHC side, we're also trying to put together a webinar to kind of guide health centers on the availability of what funds are out there to support COVID work, especially for uninsured patients. And so we're going to put together a webinar and partner with HRSA to kind of walk through all the different pots of money and how health centers can use them as we still navigate through the pandemic.
Next, we'll go to Carla and then to John Santasteven.
Yeah, I wanted to make a comment about that too. You were explaining all the different pots of money, and I know that we have tried a couple of times to access some of the rural funds, and we really just never really seem to be able to get information back on that. So I'm glad to hear that you're going to do some kind of a webinar or something about some of that, because I know like the rural hospitals in our area were able to tap in and receive really quite a bit of money, and we wouldn't even hear back if we were eligible or not. So I'm glad to hear that. Thank you.
John? You're muted, John.
Yeah, thanks, Mike. I just want to add a little bit on the workforce, because I think we face two challenges. One is, the long term, what do we do in growing our own, but also the short term with the American Rescue Plan dollars running out in May of 2023. And as I talked to a lot of my colleagues across the country, many of us have invested those in wages just to retain and recruit staff members. So I think we got a significant challenge. And I just want to mention that in the Finance Committee and also in the Agricultural Farm Workers Committee, there was a significant discussion about the workforce, what I call the fiscal cliff we're facing in May of 2023. And really what I consider a significant threat to our program and to continuing patient access at the same level.
Eva?
Yeah, I wanted to go back to the issue of the reimbursement for the uninsured COVID services. So as many of the health centers now, several hundred, have been identified and are going to be publicized as the test to treat centers. And I think that the issue for centers such as mine and several others in New Jersey is that while we might even be able to sort of rearrange funding for our own staffing and our own on-site stuff, the cost of the PCR tests is what really is an issue for us. The portal not only reimbursed us for the services we provided, but it reimbursed LabCorp and Quest and all the other labs, which are charging some hefty fees. So I think this is going to be a big issue for us around testing, not just vaccination, but the costs, who will pay the labs for those services, and particularly for those of us who are now going to be publicized as test to treat. I don't know where we're going to get the money to do this for the uninsured.
That's a great point, and especially for, outside of the health center patients too, right? And I think that's what you're getting at is
exactly
for the general population. If they're coming in and they're going to be, new patients, this is not the way the administration, I think, played it out. I think congressional leaders will say the administration came in too late. They believe that they provided the rationale. And, in one sense, for us, I think rather than getting into the nitty gritty of the offsets or discussions around that or the politics of it, just talking about the impact to health centers and the need for funding to be there, to be flexible and meet the needs of the patients is going to be the most important thing. But that's a really great point that you raised there.
Thank you, Joe. Any further questions for Joe before we move on to Visharia?
Mr. Chairman, before we do move on, I just wanted to reemphasize the need for us to continue to have support from the field whenever we do send out call to action alerts on advocacy to educate our congressional leaders. Our staff is fantastic. Our PPR staff is super fantastic. However, they can't do it alone. We need the health center voices to be very loud, very strong, and very united. So just sending out that little thoughtful note, please. Thank you.
Visharia, 340B.
340B, and as always, I will make it my best to keep my remarks brief. So I'm going to start probably with the worst and then work my way to some good news. So last week, Gilead announced that they were going to be the fourth manufacturer to have contract pharmacy restrictions that apply to all covered entities, which included health centers and all other grantees. This is very unfortunate, as Gilead had just recently ended their voluntary PrEP program that made PrEP more affordable for uninsured patients. And so this is definitely a blow to the community and the health centers that provide hepatitis C treatments to patients, as it's a very costly treatment. It's a 3-month treatment and could range up to maybe like $60,000 for a patient if they do not have insurance. So NACHC has sent a very strongly worded letter to Gilead, letting them know how this is impacting the health center community and that we hope that they change their mind before the requirements are implemented in the beginning of May. We also did an advocacy push as we are encouraging members, echoing what Rachel said, to encourage their members of Congress to endorse the Protect 340B Act, which would not solve our contract pharmacy issue, but it would address the pickpocketing that happens when PBMs want to make up for the rebates that they feel like they're losing based on reimbursement. So I encourage all of you all, if you have not, to contact your member of Congress and tell them to endorse the Protect 340B Act if they haven't. And we are also assessing what steps NACHC can take in regards to Gilead's actions. We still have to meet with Bozeman Tucker to see if another alternative dispute resolution petition is the right step for us, given that our current petitions have taken about 1.5 years to work their way through the process. We want to make sure that our response to Gilead is impactful and effective. So we're still evaluating our next steps there, but we'll definitely keep you all posted on that. Under the charges that the board has given the policy team over the years, we're starting to develop legislation in regards to the contract pharmacy issue. The litigation has moved very slowly. The litigation between the manufacturers and HHS, as well as our pending court case and our ADR petition. Even though we could have the best outcome in litigation, it still will not resolve all of our contract pharmacy issues. So the best way to do that in a permanent way is to take the legislative approach. So we have been working with some of our 340B members, health center experts on what they would need in contract pharmacy legislation and what that really needs to look like. We're starting to put pen to paper and hoping that we can join forces with 340B Health, which is the hospital entity that represents hospital 340B groups, and hoping that we can make progress working with our coalition partners. So in an effort to support that contract pharmacy legislation, once again, we will need a big advocacy push behind that. And to make our advocacy push really strong, we're also working on a 340B survey to get some concrete data on how many health centers have contract pharmacies, how many health centers have in-house pharmacies, what are the top drugs health centers use, just having those concrete data points specifically for health centers. It's not as much data out there about how health centers use the 340B program, and for us to really make some noise, we need our own data to stand on, especially when we're lobbying the Hill and working with members of Congress. So when that survey does come out, really encourage you all to respond to it and share it broadly so we could get the widest scope of responses to make sure that, you know, this NAC data is very concrete and we could use it in multiple ways. So on to the good news. We're going to be launching 340B office hours starting April 12th. We're still working out the topics, but I'm really excited about it. I think a new goal that I have set for 340B is that we recognize that 340B savings are a very huge part of health centers' operating budgets, and we want to make sure they have the tools to maximize their 340B programs and making sure they're working efficiently and they're capturing every dollar on the table. So 340B office hours will bring back that compliance approach and making sure we can get into those nitty-gritty issues with health center pharmacists and they have the resources they need, but also connecting with their peers and learning from them. So we have also partnered with the PEXs who will help us in the background in shaping those office hours, but that will start in April. And then my last thing, I'm excited to announce that we are going to have 340B Day at CHI. I'm very excited about this. So it will be a full day of 340B programming on top of other programming we have at CHI. But this is another effort in trying to just make sure health centers have the information they need. And as much as we pour into policy, we want to pour into operations and compliance. So more to come on the CHI front, but 340B Day, I'm very excited about. It should be an all-day programming as well as roundtables for health centers to connect with each other and build their network. And we're hoping to be able to have a one-day registration for health centers as well to make it as affordable as possible. But I hope to see everybody in Chicago in person, I hope, as I'm sick of being on Zoom just like everybody else. But more information to come definitely on 340B Day at CHI. And I'll take questions if anybody has any.
Are there questions for Visharia in 340B? I don't see any hands, Visharia. Thank you.
Thank you.
Mr. Chair, it's amazing to see what makes Visharia happy, food and 340B.
Good food at our conferences and 340B, yes.
That's right. Oh yeah, I did forget the good food, right? All right, Mr. Chair, we're going to move on to the organizational development update. As part of our update, we wanted to provide a more detailed description of where we are in the process. And I think Dr. Miller mentioned it earlier. While we are all anxious to get to implementation, it must not be about quick solutions. It has to be a methodical approach with an eye to long-term solutions. And that will take some time. Now, having said that, I'd like us to begin with hearing a joint presentation by members of the staff-led DEI work group and the organizational development team. And I will have, we'll have Rita Lewis, Eurico de la Cruz, and Jason Patnosh, and they will be taking us through part of the process and the work as well as a status on where we are as of right now. So let me turn it over. I believe Rita is going to go first. So take it away, team. Thank you.
Great, thank you, Rachel. Good afternoon, and thank you for this opportunity to share our work to date. Again, my name is Rita Lewis. I am Deputy Director of Clinical Quality Improvement and Clinical Affairs. I am also a member of the DEI work group. So I am kicking off this update from the DEI work group and the ODT combined. And on this slide here are the other members of both groups, but you'll hear from Yuriko and Jason as well as myself today. So before we dive into the key issues and solutions crosswalk, I want to provide some context to how we got to this product. The DEI work group was tasked with creating a scorecard to track how NAC as an organization was meeting goals and milestones in our effort to improve the challenges named by staff over the years. So as we began this process, trying to create the scorecard, the DEI work group realized that we lacked a central place to properly identify, categorize, rank, and sort the various issues and solutions. So as a result, we created the crosswalk you see here on the screen. And this document outlines the most pressing issues raised by staff over the years from various surveys and feedback sources. This table helped to clearly see the most pressing issues, how they were categorized, the source, the frequency of which each issue was raised. And all of this information helped the DEI work group to rank the issues and determine which were the most pressing and of greatest need to address first. Of note, the solutions you'll see in the columns to the right of the slide do include recommendations provided by Link within the organization assessment report. Also included are solutions presented by staff to demonstrate that their voices were being heard and being considered as we're trying to really address this really important work. So of note, you'll also see that there are solutions that are in bold and highlighted in yellow. Those were the solutions that Link identified as the top 9 recommendations to address as of greatest impact. So we wanted to make sure those solutions stood out first as we were looking through and identifying where to kind of tackle everything. So in total, this crosswalk does highlight 29 key issues from 7 different sources. 7 of these 29 issues were deemed high priority or high risk or just really important to address first to really help address the key issues that staff have identified here at NAC. So that way we were able to move forward in the best way possible. Also, all of these solutions, or most of them that you'll see here, have at least 2 proposed solutions, which has been really impactful for the work that the ODT is going to do with the performance teams going forward. What we did on this tab of this was we wanted to kind of cross-reference all of the top 9 solutions that Link presented to us, just to see if we looked at all of these solutions and addressed those first, how many of the various issues would be addressed and which ones were they. So we wanted to kind of have a 2-pronged approach to how we saw the issues and how we addressed them. So next I'll have Yuriko, she will cover the staff engagement portion and how we prepare staff for all these next steps moving forward.
Thanks so much, Rita. Hi, everyone. My name is Yuriko de la Cruz, Program Manager, Social Drivers of Health within the Public Health Priorities Division, also a member of the DEI work group. Wanted to just thank everyone in terms of really being able to engage with us during this process. And we are really excited that we've been able to shift this stage of the DEI work group and really think more about how do we really think about and be very intentional about what are the cultural issues at NAC and how do we really sustain long-term change so that we're better for the future. We serve all of our communities across health centers so that we really, the workforce here at NAC can really continue to support NAC, the members at NAC. So in terms of the key issues and solutions crosswalk, we did share it with staff in January. We provided an overview of the key issues crosswalk, and we also made it available on the public Teams channel for the ODT that they created. Also, we were able to work with the ODT. Back in December, we worked with them and provided an overview of the crosswalk to everyone that participated in the lunch and learn that the ODT hosted. And this was just a way for NAC staff to be informed of the process and also think about how do we continue to move forward. And then last month, I actually facilitated a workshop on PDSA cycles. And this is a great kickoff to really think about how do we work with our staff here at NAC to get the teams up and running. So Jason will talk more about that, but we're really excited that the launching of the teams will happen in the next couple months. We have a lot of resources and we're working collaboratively with the ODT. So the rest of the DI work group members, as well as the ODT, we're working in partnership to really think about what are the supports and the resources that the NAC staff need in order to get the work done here at NAC. And at this point, I'll hand it over to Jason.
Thank you, Eureka, and hope everybody can hear me. My speaker went out moments before starting. So what I wanted to share with my screen today, and thank you to the board for having us present today, the transfer now to the performance improvement tracker. So this is taking the crosswalk and making it a living document for staff to be able to interact with and be able to see how the progress is being made in each of these areas. It's accessible to all staff on our internal Teams channels. And what we did with this tracker is we set up a background piece for it. So staff coming in, if they started tomorrow, they could become oriented to where we are in the process. They can go back to previous training on it and also look at the crosswalk. So what you saw from what Eureka had shared and Rita had shared, the crosswalk has now formed into this tracker. So you see the same different issues that were identified as we went along. They're priority areas. And now we've also added progress steps. So staff can see how we're making progress as we go. Within that, the ODT also organized the different issues by key areas. So professional development, internal communications, business intelligence, leadership, board relations, DEI, post-organization restructuring items, and then critical elements that we're still determining how to organize. This allowed us to really take on some of these key issues and start to see where can we prioritize the initial teams. Moving into those initial performance improvement teams that Eureka talked about, we started with 3. The first 3 being professional development and improving communications training for staff. So as you can see, the recommendation was identified. We carried over 2 of the solutions in this area around communications training. The staff will volunteer for these teams, will fill in their members. They have a team objective on what to take on, and then they'll move from there. They will fill in the team aim, the goals of their work, set their start and end date for their work, also identify who else in the organization may be responsible for this work, they may need to consult with, and others that may help to inform their work. And down below, they'll share brief notes. And this is where if somebody's not on one of the PI teams internally, they'd be able to track their colleagues' work through these notes to see how the progress is being made. So each of the teams will have their own worksheet to go from. The 2 other teams moving forward with to start, business intelligence around customer feedback. And this is really looking at what was noted as a disconnect between the field and what NAC may be providing, leaving the door open to competitors, and specifically looking at, considering a voice of the customer exercise and how to source other ideas and recommendations from staff and members to increase value to the members. And then the 3rd team is around professional development and staff retention. This is, like Rita had pointed out, many of the criticisms or recommendations had multiple items under them for solutions. So this one does have multiple of succession planning and leadership next steps, but our focus is specifically around retention. And so this PI team will look at some of the retention issues that go with it. Within this, and what we can say, as the PI teams go through their work, they'll go through their PDSA cycles, make recommended actions that will show up here in the tracker, the actions that get implemented, and then the completion date. So this has staff have access to all of these resources. They can see where they are on teams internally. We've also gone back to now add the past trainings, the past organizational assessment reports, other past assessments that have been done. So as new staff join the organization, they're able to be brought up to speed with this. With the initial PI teams, Eureka had shared this on that last slide, We expect the first teams to roll out over the next couple weeks. I can report back that nearly 40% of staff volunteered for at least one of these teams that will be represented. And that's a great testament. And these were staff who may be serving on other teams already, but we could also say it extended beyond staff that are serving in the DEI work group, the ODT, or serving on other committees, internally organizations. So this is really reaching out to staff at every level. So I'm happy to take additional questions. Look to my ODT teammates of Rachel and Ben and Lori if there was anything else that we missed here, but we are rolling ahead.
Jason, before we go on to some questions, Mr. Chair, I just, as you can see, we've made some considerable progress. And as they said, we're almost ready to launch the teams. However, there's one more point to make at this juncture. Staff have experienced impactful events over the years, and especially even the last two, right? And we need to offer some kind of support that will lead to healing. We've learned a new phrase this week. It's very poignant. Culture eats strategies every time. And I want to repeat that again. Culture eats strategies every time. We must find a way to support healing, all the while working toward redesigning a robust organization that will foster equity and transparency, as well as a professional environment where staff feel that they are empowered. So so now let's turn it over to see if we can answer any questions that y'all may have. I do want to thank Rita, Yuriko, and Jason for their presentation today and the work to prepare. But I also want to thank the rest of the teams, the rest of the members on the DEI work group, as well as the rest of the ODT team. So I believe Beth has her hand up, Mr. Chair.
Yeah. Thank you, Rachel. And thank you to my thanks to the ODT, the team that's going through some really hard work to improve the organization. And I'm in full agreement that we also need to look for a healing process for some of the things that we've all faced over the last couple of years. So let's go to Beth with her question.
And I'll just make it really quick. So do we have a way to see, this is great work and congratulations on the group, but that we're making progress? Do we have some kind of survey, baseline survey, and then, or whatever it is, and we're going to do it again to make sure we're moving the needle?
You're talking as far as staff and how,
yeah,
right?
And I agree with you. Staff is the number one thing right now.
That's right. Totally. Thank you for asking that question, Beth. That is definitely one of the things that ODT is going to be working on with the DEI work group. It's not something that we're going to work in isolation on. So we don't have it now, but it is on our radar, on our list of things that we need to deal with. Thank you for bringing that up.
Let's go to Dan with a question.
Yeah, thanks, Mike. To the teams, just another great presentation, and thank you for this work. And to you guys and to Rachel, I'm curious, Rachel, I agree with you. Culture does eat strategy every time, and changing culture is tough and painful at times. And I'm curious, as we're working on this restructuring process, how are you visioning kind of, putting some power behind the recommendations of the teams to actually accomplish what comes out of it, so that it moves beyond kind of reporting and tracking to really that tough work of culture change? How do you imagine that beginning to happen?
I think it doesn't go very far until we start to have trust among the staff, Dr. Miller, quite honestly. And that's something that we have to work toward and we have to earn. And it's not something that will happen overnight. But I think it's taking baby steps, and all the same time, as I said earlier, trying to find a way to support staff in their healing and trying to encourage those that don't feel like they have a voice to speak up so that we can hear, because everybody has value and everybody brings that gift to the table. And we need to make sure that everyone feels that. And it's not just words that we're saying, that we really live by that, right? I don't have a straight answer for you. We're learning and we're growing and we're trying everything we can as we're going forward. And we will honestly need to bring in help from the outside. We don't know We don't know some of this stuff. We're trying to do the best that we can, but we know enough to know we don't know everything. So we are going to be asking for help from outside consultants, quite honestly, to be able to come in and help us guide some of that work. So it's a lot of work. I don't know that I answered your question, but I don't know that I really have a good answer for your question, unfortunately.
It's not what we say going forward, it's what we do. And so we're certainly open for suggestions as we go through this process and try and undo some of the issues that we've faced over the last several years. And it's going to be a process, and it's going to be one step at a time. Hopefully we can make more steps, take more steps forward than backward. But we have to realize that it's a process, and we just need to keep at it.
And I think I think the other part, if I may, is that communication and trying to be as transparent as possible, and the constant communication with staff at all levels as much as possible, and sometimes to the point of over communicating, which right now I don't think that that's ever possible. I think we're just going to have to over communicate to just try to make up for what wasn't done in the past, quite honestly. And I don't mean that disrespectfully, but that's the reality, right? So we are counting on our own staff to help guide us, Dr. Miller, quite honestly, because they're the ones that were in those shoes. I wasn't there, and I realize that. I've been there last 2 years, but I was not there, and a lot of us were not there. So some of the staff that have been there for a long time are going to have to help guide us, and we're looking forward to that.
Thank you, Rachel. I appreciate that there's not a simple answer. And I think as you're voicing it, and Mike, as you're voicing it, it's an honest answer. And as you say, I think that transparency and honesty is crucial now. Can I also just add, it seems to me that amongst NAC membership in general, that communicating some of what this great work is going to be really important. I think people have been hungry for this for a long time, and I'm assuming you have some plans in place to start sharing this beyond the board and beyond staff.
We wanted to start here. We definitely sent out an overview to the PCAs and then also to the membership, and I believe the board received it as well. That just gave an overview of the link report and a very brief update on what was going on. It was very general, yes, but we did want to make sure that the board received a report first. And so then that's the next part of the strategy that we need to figure out. How do we get more information out on what kind of basis, and do it in such a way that that provides for that separation, right, of internal work, but gives us enough flexibility to be able to share it with the outside. There's a fine line that we want to maintain, obviously, for internal work.
Thank you, Dr. Miller. Are there any other questions for Rachel or the team?
Not necessarily a question, Mike, but a comment. I from the vantage point of someone who had to effectuate cultural change, I'm so glad to hear the responses that you and Rachel are putting forth, recognizing that it really is what you do, not what you say, and that change of this type really takes time. It is a process. It is very much a process. So it would seem to me that you're very much on the right track. So kudos.
Thank you, Mr. Taylor. I appreciate that.
Thank you, Michael. Any other comments or questions for Rachel on this particular work that we're doing?
Keep up the good work.
Yeah.
Thank you. The team is great.
The team is great.
They're working hard, and we've got some really, really good staff.
Absolutely. They're superstars, all of them.
Embrace the magic. Embrace the magic. It's there.
Oh my God, yes. They're amazing. I love it. I'm very humbled to be working with them, and I truly mean that. They're just, okay, don't make me cry. I got to keep going on this report.
I get it, Rachel.
Thank you. So just a little bit more, Mr. Chair. I do want to say a little bit about the reorganizational the organizational restructuring, that's a mouthful, that we're working on. As you know, we did bring in Link to help us with this, and we did conduct an all-staff meeting earlier today where Link provided an overview of the process that they will be using as they guide us on this journey. And then on April 12th, they will provide staff with another update on where we are at that point. We will have information in weeks to come to you, Mr. Chair, and the board, of course. And obviously the board will be reviewing the final recommendation for the organizational chart as they work toward approval of that. We don't anticipate that happening probably until the next board meeting, but we will try to keep you updated, the executive committee updated, and then you will guide us as to how else to share that information when appropriate. I do have at least one other item to talk about this afternoon with you, sir, and it was something that was sent out just about an hour probably before the meeting. So my apologies for the lateness, but we do have some COVID protocols that we covered with the executive committee that we also wanted to share with you as board members. You know, we need to be preparing for the conferences that are coming up. I know that the Conference on Agricultural Worker Health is coming up in early May. Hope all of you will be there and looking forward to that. But we also have other in-person trainings that staff is preparing. So we would like to recommend at this point that we implement the protocols that we used during NACHC 2021 CHI conference. Just go back to using those. That document has details. As I stated, it was provided earlier today. We are cognizant that these protocols will need to be reviewed and modified should the COVID situation change, and also to the point of being compliant with state regulations. So we just want to make sure that you are aware of that and concur with the recommendation, Mr. Chair. And I think I'm going to stop at that point, but we're happy to answer any questions that you may have.
Any additional questions for Rachel or about the protocols and the changing COVID environment?
I did have a question.
Yes, go ahead.
Just real quick. So I did read this policy or whatever. Is it going to include the boosters or is it not? Or you haven't made that decision? I didn't quite understand that.
So we're going to be, and I think Mary is on, so Mary, chime in if you want to, if I missed something or misspeak. So what, Ms. Belcher, what we're going to be doing is basically placing a lot of this on personal responsibility, right? We need to be able for people to say we can't, to actually do the right thing, right? And if not, they need to do whatever precautions they need to take to protect others that are attending along with them. So that's the approach we took before. If you do a test, it's good for that moment. It doesn't mean it's going to protect or keep you from spreading it, right? And the same thing goes with the vaccines. It's
no problem. Thank you.
Thank you, Rachel. Any other questions for Rachel? If not, we'll move to old business, our unfinished business in the Florida planning meeting. Is that you, Rachel?
It's mostly going to be Dick, believe it or not, and I think he's on. He might be only on by phone. I'm not sure. Dick, are you on?
Dick, if you're on mute.
I thought you would. Lori, can you tell if Dick is on?
Okay.
There he is.
On.
Okay, thank you, Dick. Go ahead.
Thanks, thanks, Rachel, and thanks, Mike. I'm going to put my presentation into 3 topics related to the June planning meeting in Florida. I want to talk a little bit about the underlying assumptions for the meeting, the objectives, i.e. what do we want to accomplish, and then finally, how to structure the time for the 2.5 days that we're together. So with some core underlying assumptions, and it's very consistent, okay, with the last hour and 20 minutes. This meeting will build in part on past work. The strategic, plan, that emerged in June of 2021, and then a a small, focused one-day session in December of 2021. Number two, though, this meeting will also build and incorporate the present and ongoing work, the things that were mentioned that the DEI team talked about, and what Rachel mentioned in terms of a work around organizational restructuring. Third point, underlying assumption is that this meeting needs to be structured and carefully planned out, and we're going to seek the help of 3 external parties. I'll give you the name of the organizations, but then I'll bring them to life. Adaptive Strategies is one group. Partners in Equity is a second group. And then the Link Strategic Partners is the third group. Adaptive Strategies will be represented by Josh Lasky. Again, many of you knew Josh. Josh, has been with Link, but recently, moved to a different organization. Partners in Equity, that's Janice Sherman, who again, many of you have worked with and know. And then finally, Link Strategic Partners will be a combination of Michael Aiken, again, the president and CEO of the, of Link, and one other of his senior managers. Second, objectives. And here, we want to make sure that we update the critical forces likely to impact the work of health centers over the next 3 years. And that's, again, a combination of industry, politics, government, etc. Secondly, we want to affirm or modify the vision that's captured in the NACHC strategic plan, of 2021 to 2025. Third, we want to make sure that we've looked at, and I heard the comment about culture eating strategies, but I'm still going to say, that, look at key strategies, that are of a legislative, a policy, organizational nature that will be needed to accomplish the vision. And then finally, we want to make sure that we work with the 6 pillars, to really, to strengthen and augment them, not reword them, but, to start to put, meat on the bones, of a skeleton that exists. Finally, structuring the time. We'll begin Wednesday afternoon, the 15th of June. We'll spend, several hours, really setting the environmental context. Thursday, we'll devote, to focusing back in on the vision, and seeing, if that vision, is still, the appropriate one that we're working towards, as well as then start to say what are the core critical, actions as part of strategies, whether they be ledge strategies, policy strategies, or the organizational strategies that are going to be needed to achieve a vision. And then Friday, we'll look, at each of the 6 pillars. We'll be able to divide into smaller working groups, so that at the end of Friday, we will have accomplished, putting more actionable, type items into each of the pillars. That will finish, the planning part of Florida. As I'm sure all of you know, Saturday you have a board meeting where we will have a chance, I'm sure, to reflect, on what we accomplished Wednesday through Friday, as well as something Rachel mentioned a few minutes ago, to look at some of the organizational restructuring, work that's coming forth. So Rachel, I'm going to stop there. And Mike, I cannot see if there are questions, but you're going to have to be my eyes and ears to,
I will do that, Dick. Thank you. Before we go to questions about the June planning meeting, Warren, did you have a question?
Oh, no, it's fine. Thank you.
Okay. Any questions for Dick or for Rachel about the June planning meeting? Comments? Seeing no hands up, we will move
Mike,
to.
hey,
Yes.
Mike, let me just make one other comment. I have not checked in the last few days with Laurie Riddy, but when I checked a week or so ago, we were getting a very, very high acceptance rate to the invitations. I think we'd only had, of the ones that had come in, fewer than 5% of the respondents were going to be unable to participate. So would envision, when it's all said and done, with board members, health center, people, NACHC staff, and resource people, we're probably looking at about 120 people. Could it be, so in that range, just so people have a feel for it. And again, going back to the reason to have contracted facilitation resources to make sure that the groups that we form, okay, to accomplish the objectives I mentioned, that we'll get to that point. So, sorry, Mike, but thank you.
Thank you, Dick. Lathan, you had your hand up.
Yes, Dick answered part of it in terms of expected attendance, but Dick, I didn't hear you in terms of the breakout groups. I think it's maybe 2-3 years ago, there was a group with just the board members, the health center board members separate, because they have a different perspective, and that went over really well. Are you considering that at all this time?
Lathan, okay, for folks who were not part of that meeting, I think you're right. It was probably 2.5 years ago, and it did work well. The actual design, Lathan and everyone else, okay, of the 2 days is definitely a work in progress, and I guess I want to just say, so noted, Lathan, and something that will factor into the planning, whether there's a way to capture that group and do it in a way that kind of feeds and is consistent with what we're trying to accomplish. So thank you for reminding me.
Thank you, Lathan. Dick, any other questions for Dick about the Florida planning meeting? Seeing no further hands, we can move on to new business. The agenda shows
I'm
approval
sorry,
of the.
Mike, I'm not quite sure. Do we have a board meeting during that time?
Yes, the board meeting will be scheduled for Saturday morning.
Yeah, I thought so. Thank you.
You're welcome. Moving on to new business, I see the first item is approval of the nominating forms. I believe we took care of that under the action items from the committee reports. The second item of new business is the Migrant Health Awards. We approved the Migrant Health Awards in the executive committee. We have 2 awardees for Outstanding Migrant Health Center, 2 awardees for Lifetime Achievement in Migrant Health. We have 2 awardees in the Outstanding Migrant Health Center Board Member Award, and then 2 awardees in the Outstanding Migrant Health Public Service Award. And so they're listed in your board packet under the March 8th Executive Committee minutes. We have very deserving awardees. And so if there are any comments or discussion, we need a ratification vote from the full board to approve the awards for migrant health and agricultural farm workers. We have a motion from Jim. Is there a second? Second from Vince. Any discussion? Hearing none. All those in favor signify by saying aye.
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 Or Michael's thumbs up. That works too. All opposed, nay? Hearing none. Any abstentions? Motion carries. Thank you very much. We are pretty much on schedule. The next piece of business will have to be done in executive session. And so there is another link from Destiny Boyd to move to executive session. We'll start at the top of the hour. And so at this point, we need a motion to move to executive session.
I move we go into an executive session.
We have a motion. Is there a second?
Second.
We have motion and second. All those in favor signify by saying aye.
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 Motion carries. We will reconvene the meeting in about 24 minutes or so with the new Zoom link. Thank you very much.
Thank you.
Thank you.